Tell me about your symptoms. Tell me what's bothering you.
What's bothering me the most is I am not a person that likes to sit around and do nothing. I get very irritated when I can't do the things I want to do, but because of my back, I can't do it.
Yeah, you have as well pain, right?
Pain.
1 to 10, how bad is the pain?
It is, a lot of times it's a 10, but
Okay.
very rarely is it a 2 or a 3.
So every day, pain is up
Every
to 10.
day, every
How
day.
far can you walk?
I can't make 40 yards.
Okay.
And that,
How long has it been going on?
pardon me?
How long has this been going on?
Well, this has been going on 10, 15 years already, and each year it just gets worse and worse.
May I ask how old you are?
I'm 80.
80.
Just turned 80.
But you're pretty fit for an 80-year-old. You're a fit 80-year-old.
I feel like I'm in pretty good
Yeah,
health except for this. And
Except for this, that's the point. Now, this people who haven't had the pain of 8, 9, 10, they don't know how that feels. Can you describe for somebody, maybe younger people who don't know what that is, how do you feel when you have that kind of pain? What can you do and what can you not do when you have that kind of pain?
Well, one thing, when it gets to the point where I have to go sit down, and I sit and I go, oh, and it takes 2-3 minutes before it'll finally cease a little bit.
Yeah.
And then I can get up and do some more, and if I'm doing dishes, it's not very long. I'm right back in that chair doing it again.
And this.
I've done the injection shots, and I've done the stimulator.
Yeah, well, we'll come back to the stimulation device, but so you went to doctor. Here is your spine. Here's the stimulation device that's placed. Here in the side view, we see that the bone is already grinding the bone in many levels, but look at that here. This is the front view of your spine. This is what we call grade 2 lateral listhesis. Look at how far that bone is hanging out. This is up, down, and this is the right, this is the left. And these are the individual bone, and between is the disc. Look at that, this one is almost falling off. Almost, we get called grade 2 spondylolisthesis, lateral listhesis. But as well, you have scoliosis, and that scoliosis is not a little. This is significant. I'm going to measure it. Between those two levels, your scoliosis is 33 degrees. I just was measuring it, meaning that literally your spine is falling apart. A stimulation device in certain situations works. What it does, now pain is a signal that something is wrong. Pain itself is, most of the time, is not the problem. Something that causing the pain is the problem. And that something, in your case, is the discs are destroyed, your spine is side bending, its bone is grinding the bone, and literally material of the disc and the bone are pushing on the nerve. This is the problem. Stimulation device is like resetting the smoke alarm and to reduce or eliminate the noise of the smoke alarm. Your house is still going to burn down even if you reset the smoke alarm, and this is what's happening. Now, did the other surgeon explain to you that you had a scoliosis? Did he explain to you risk versus benefit, what the options are? So you can, how did you guys come to the conclusion that for a grade 2 lateral listhesis with a scoliosis of a 34, almost 35 degree scoliosis, how did you guys come to the conclusion that you want just to put a stimulation device in this situation and not fix the problem? Do you remember that?
Well, just going in, listening, was told this is probably what's going to help me, you know. And as a doctor, I believe the doctor in that, and I was willing to do it.
It is not the kind of blame on the doctor. It is
No.
But did he explain to you have a scoliosis, side bending of the spine, you have a lateral listhesis, spondylolisthesis, it is in a horrible shape, but nevertheless we are not going to fix that, we are going to just treat the symptoms. Did he explain that to you?
That's
it's a while back, I know.
It is a while. I don't remember going through all that.
Yeah,
you know,
But you know what I'm getting at is, I think we surgeons are good at weighing risk versus benefit in our hand. This is a multi-level from 5, 4, 3, 2, here 5, 4, 3, 2. This is a 4-level spinal fusion, maybe even 5-level correction of deformity, and so on. In an open, old-fashioned surgery, this could be easily a 12-hour surgery and a gallon of blood loss. And that is where I think the other surgeon was a good surgeon. He weighed risk versus benefit in his hand and decided that is too much surgery for you. And but I think, you know, it's fair to say that, you know, that would be too much surgery, a 12-hour surgery with a 1.5 year of recovery and so on. And I see all the time this kind of patient. The only difference is that we do that surgery. I just did that surgery 2 weeks ago, and that surgery took me about 1.5 hours to do, and patient stayed in the hospital just 1 night. So we do this surgery with the new technique all the time. And I think, you know, it's as well fair to say that I could have told you that when your problem is that bad, that the stimulation device will not help you. Because the problem is the bone literally is grinding the bone, your spine is from the side falling apart. This is a mechanical problem. I need a mechanical solution. Just resetting the smoke alarm is not going to fix your problem. How far overall?
With that grinding, that's what's causing my pain, isn't it?
Yeah, but that's causing the back pain, yeah. Now, I think I can help you if I can go through my entire protocol, but I will explain to you all the other options, you know, and we are not going to take the option for the surgery lightly, but you're the textbook of the people that we help. Now, just because of your age, people just hesitate giving you that option. They will just tell you go and live with it. Is the situation livable?
I'm not hesitating one bit. I'll do anything I can if it will
So it's not livable.
possibly help me.
No, I think the only thing, you know, I think we need to, this is not something you do, this is something I do. I need to make my colleague more aware of that. Just because they cannot do that surgery doesn't mean that surgery cannot be done. And I think they have the duty to tell people, okay, this is too much of a surgery, I'm not trained to do that, but there are people there who can truly help you. You don't have to live with that, and I don't need to do practically a surgery that I know is not going to help you in the long run at all, because you have a 35-degree spinal scoliosis and grade 2 lateral listhesis, you know. We try always to do our best, but sometimes our best is just sending the patient to somebody who's trained to fix the problem the right way. That is sometimes the best thing to do. So I go and teach this to many of my colleagues, and you know, and some of them are too old to learn new tricks, but some of them, you know, they come back and say, you know, we don't believe in that, whereas we have 1,400 patients, many patients in your situation who we have helped. Now, obviously, in medicine, nothing comes with a guarantee and a handbook, and I don't have a guarantee and a handbook, but we do this kind of surgery all the time. Okay, now, this is our first visit, we have a long way to go, but what question do you have for me?
I just, I have no questions. I just want to know if we can do something.
Yes, we can.
And yes, and I'm 100% for it.
Okay. Well, you know.
Aren't I, Terry? Because
Yes.
I'm in a lot of pain.
She's not enjoying life right now at all.
And that is the point, you know, the life that is always, you know, if you have pain of 8, 9, 10 every day, that you cannot enjoy that life.
Yeah, and I feel like I've got quite a few good years yet, you know.
Oh yeah, you know,
And
statistically you have another.
Get my legs going.
Yeah. Otherwise, you're fit. This is what's holding you back, and we have a good chance. Now, we are not cavalier about the surgery. We are going to put you in our inspired spine protocols and so on, and prepare you and so on and so forth. But if surgery is the only thing to be done, we can fix the problem. We are not going to treat the symptoms. We are going to fix your spine that's falling apart. with that the OLLIF procedure, OLLIF technique. There's not a week we don't do many of those things, and this is not even the worst kind of scoliosis I have treated. Yours is 35 per degree. We have treated scoliosis up to 55 degree. So this is neither the hardest nor the most complicated situation. Obviously, again, no surgery comes with a guarantee, but we have enough data to say we can help you.
Yep.
Okay?
I understand
Well,
all that, you bet
well,
I do.
Well, thank you so very much for the interview, okay?
Okay.